I remember thinking, is this real? The doctor just told me my baby wouldn't live. She had a twisted bowel and it was life-threatening. I never knew how important a bowel was until that moment. As a 19-year-old girl, soon to be single mom, I felt I was wandering around in the dark. When Eagle Wing Woman was born, she was immediately rushed away for surgery, and the surgeon said even if it was successful, she probably wouldn't live more than a year. After the initial surgery, she developed neck, which resulted in more surgeries and even less bowel than she had before. This meant that she would have to be fed through an NG tube and receive life-sustaining support through IV. She spent the first 18 months of her life in hospital. I was numb. I never left her bedside surrounded by fluorescent lights, strange smells, and beeping machines. Every day was different. Her health status could change hour by hour, and when I finally went home with her, I was scared. I never had been a mother without the support of nurses 24 hours a day. My mental, emotional, and spiritual health were non-existent, and my physical health suffered, along with my daughter. There were many days I didn't think I could get out of bed, but I had to. There was no one else. It took years before I was able to accept that I was a medical mom, and with that acceptance came the realization that I was capable. I could care for my daughter, and I started to look at our quality of life, work, family dinners, birthday parties, and most importantly, connecting for the first time with my culture. One summer, we drove down to the USA to spend time with my sister's in-laws, and they adopted us into their Ani, White Clay Nation family for the Sundance ceremony. When we entered the lodge for the first time, both my daughters and myself felt a change. The energy and prayers made us feel loved, safe, and connected. We came home from that Sundance feeling stronger, and we've been back every year since. Our medical team began to notice a change in me. I was more confident, had become more of an advocate for my daughter. One day my doctor asked me about the change, and I didn't know what to say. I was nervous to tell him that we had started attending traditional ceremonies and other traditional practices that had been passed down for generations. At first, she had lots of questions, but I couldn't answer her questions. I was still learning about my own culture. I assured them that I wouldn't be stopping my daughter's current treatments, and because we had built such a good relationship, they trusted me, and I trusted them. Eagle Woman is 15 years old. I feel like we've grown up together. She is my best friend, my other half, my little sister. I always admired her strong, beautiful spirit as she lives her life in bravery. She has taught me to live full of heart and in prayer. I am now the health policy liaison for Yithka and Sutana. My experience as a medical mom and my understanding of Western and traditional practices allows me to help others navigate a very complex healthcare system while embracing their own culture.